Hello, everyone. We are glad you could join us for this Federal Programs Unit webinar. The purpose of this webinar is to discuss the Missouri HealthNet Division Record Review process. Missouri HealthNet Division is also known as MoHealthNet or MHD. This webinar will provide a general overview and understanding of why the waiver record reviews are completed as a requirement of Centers for Medicaid and Medicaid Services, known as CMS. It will also explain the information necessary to gather, organize, and submit a complete record review. Let's start with explaining the waiver assurance cycle and how record reviews fit in this process. We will be discussing each of these components in greater detail in the following slides. You can refer back to this slide to understand how each component fits into the waiver assurance cycle. This is one component of the overall quality framework to meet the waiver assurances, and this component is MoHealthNet's process. The cycle begins with the Centers for Medicare and Medicaid Services requirements, which are the 6 waiver assurances: level of care, individual support plan, provider qualifications, health and welfare, financial accountability, and administrative authority. There are 6 waiver assurances, but for the purpose of the MoHealthNet record review process, MoHealthNet focuses on level of care, ISP, and financial accountability. MoHealthNet conducts the record reviews. MoHealthNet findings from the record reviews are then received by the Division of Developmental Disabilities. TCM TACs coordinate remediations of all record review findings with the TCM entities. The Division of Developmental Disabilities submits to MHD a detailed report outlining the individual remediation for each record review finding. This report includes what remediation steps have been and or will be taken to ensure that the areas needed to be addressed do not recur. And finally, MoHealthNet's reporting to CMS. So what exactly is required by CMS? CMS requires that each state that has an approved 1915C HCBS waiver have a system to ensure that participants receive supports and basic waiver assurances required. HCBS waiver assurances are how a state intends to meet CMS requirements. As mentioned in the previous slide, the 6 assurances the Division of DD must meet and show compliance with are level of care, individual support plan, provider qualifications, health and welfare, financial accountability, and administrative authority. MoHealthNet record reviews are mandatory for all 4 DD waivers. CMS requires the Medicaid agency, which is MoHealthNet, to provide oversight to the Division of DD, which is the operating agency of the DD waivers. MoHealthNet provides the Division of DD with a statistically valid sample of participant waiver records to review for compliance and to verify whether the division is meeting the required expectations. The specific documents requested and reviewed by MoHealthNet are the level of care determination form covering the current review period plus the previous level of care in order to determine whether or not the level of care was completed annually. Individual support plans for the current review period plus the previous support plan in order to determine if individual support plans are completed yearly. Also include any updated and or revised support plans for the current review period. MHD reviews the individual support plan for the current review period and then the individual support plan for a previous year, so it is only necessary to submit 2 individual support plans and any applicable amendments. As an example, if MHD is reviewing a period for FY17 in the comprehensive waiver, which would be July 1, 2016 to June 30th, 2017, and there is an ISP with an implementation date of October 1st, 2016, MHD would also look for the previous year ISP of October 1st, 2015. Medicaid waiver provider and services choice statements. The tool assessment as it applies, Mokabi, Vineland, or any other tool assessment used to determine the level of care. It is acceptable for the Mokabi inventory assessment to submit the first page with identifying information and the ability statements page. For the Vineland 3, it is acceptable to submit the comprehensive interview form score report for the participant. See more copies of all service authorizations only covering this review period. And finally, support coordinator monthly and/or quarterly reviews. The following slides will address the HCBS waiver assurances that MHealthNet reviews through the record review process. Included are the specific areas and components that MHealthNet reviews for each document listed in the previous slide. The 3 waiver assurances not included in this webinar are provider qualifications, health and welfare, and administrative authority. This is the level of care assurance directly from the waiver application. The assurance is, the state demonstrates that it implements the processes and instruments specified in its approved waiver for evaluating and reevaluating an applicant's or waiver participant's level of care consistent with the level of care provided in a hospital, nursing facility, or intermediate care facility for intellectual and developmental disabilities. The state must prove that each participant in a waiver meets level of care to be in that waiver. To be eligible for any waiver service operated by the state of Missouri, a level of care determination must be made that the participant is at risk of needing intermediate care facility, intellectual and developmental disabilities level of care. The State Medicaid Authority, MHealthNet Division, and the State Operating Agency, Division of DD, must have final approval on all level of care evaluations. For the level of care evaluation, MHealthNet's record review will assure a level of care evaluation is provided to all participants before they receive services through a waiver. All participants have a level of care reevaluation at least annually. Only qualified staff complete a level of care evaluation. The appropriate tool assessment is used to determine the level of care, and level of care determinations were completed accurately. The tool assessment used to determine the level of care is included in the level of care waiver assurance. The Mokabi assessment tool is used for participants age 18 and older. For children, the Vineland and other formal assessments may be used. For a list of commonly used assessments, please refer to the level of care instructions contained in the Level of Care Directive 4.061.
The Individual Support Plan Waiver Assurance is the state demonstrates it has designed and implemented an effective system for reviewing the adequacy of service plans for waiver participants. MHealthNet refers to an individual support plan as a person-centered plan, PCP, or plan of care. With the ISP, MHealthNet assures the following. All waiver participants have an ISP signed and dated by the participant, their legal guardian, if appropriate, the support coordinator, and all individuals and providers responsible for implementation of the ISP prior to implementation. The ISP must be written in accordance with the principles of person-centered planning and must address the participant's desired outcomes. All services and supports paid for through the waiver must be included in the ISP. And ISPs are reviewed in accordance with the state's policy for monitoring. With individual support plans, MHealthNet also assures that the ISP addresses the needs of each participant, including health and safety risk factors. The participant's services and supports align with these assessed needs. that the ISP contains a backup plan for participants served by agencies dependent upon the participants' assessed needs. The ISP is updated and revised at least annually. And finally, the ISP describes what people need to know in order to support the participant and specifies how much of each service will be provided, when, how often, and by whom. The Medicaid Waiver, Provider, and Services Choice Statement is included in the ISP Waiver Assurance. With Waiver Choice Statements, MoHealthNet assures that the participant has completed and signed a Medicaid Waiver, Provider, and Services Choice Statement for their current services and providers, that the participant was given choice between waiver services in the community and institutional care, waiver services they receive, waiver service providers, to self-direct their services, and to designate a family member or other person to direct services on their behalf. The CMS waiver assurance for financial accountability is: the state must demonstrate that it has designed and implemented an adequate system for ensuring financial accountability of the waiver program. The CMOR service authorizations covering this review period are reviewed by MoHealthNet to ensure compliance for the financial accountability assurance. MoHealthNet will assure that the claims paid for services were included in the approved ISP, and the claims paid for waiver services adhere to the reimbursement methodology of that waiver. The next two slides contain very helpful tips for submitting a complete and well-organized participant record for MHD to review. Please only provide the information that is necessary for the review period specified by MoHealthNet. This will include the previous level of care, the previous individual support plan, any ISP amendments, and the Medicaid Waiver, Provider, and Services Choice Statements that would cross over the specified fiscal year. Some examples of items not required or requested by MoHealthNet for the record review include the following: Division Guideline Number 38, authorizations for disclosure forms, checklist for residential moves, ISL budgets, consumer profile, request for expenditure, housemate survey, community RN monthly health summaries, medical records or letters from doctors, and provider monthly reviews. MoHealthNet asks that the documents are organized in the order that was requested. This will save time, reduce errors, and ensure documents are not missed. Saving each PDF document individually and identifying the form saves time when trying to locate an item, as opposed to having one large document with all the forms included. If file names are too long, the file may not open. MoHealthNet does accept abbreviated file names. Make sure all documents are legible when scanned or copied. If submitting a hard copy of the record, please do not paperclip or staple. All records are submitted electronically to MoHealthNet, and this slows down the scanning process. The next is a question that we get frequently. If the participant is deceased, MoHealthNet still requires submission of the record. MoHealthNet does not pull another participant in this instance. Please ensure the file will open and that it is not corrupt. And finally, keep in mind that the Division of DD has 45 calendar days from the date of MoHealthNet's record request letter to submit all requested records. MHD Findings and Remediations. Upon completion of the MoHealthNet record reviews, MoHealthNet submits a notification letter and findings to the Division of DD. A finding is when compliance has not been met and requires individual remediation. TCM TACs coordinate with the TCM entities to address individual remediation regarding all record review findings. And as stated previously, the Division of DD submits to MoHealthNet a detailed report outlining the individual remediation for each record review finding. This report includes what remediation steps have been and/or will be taken to ensure that the areas needed to be addressed do not reoccur. MoHealthNet retains the information and findings from every record review for reporting to CMS. Each fiscal year, MoHealthNet is required to submit an annual report that includes a summary of the waiver, expenditure data, and quality performance measures. This report is called the CMS 372 report. And finally, we'd like to thank you for your time, and we hope this webinar was very helpful. We would encourage you to keep or print the slideshow as a resource for future use and reference.